Lily loves her. Lily loves her bed, don't you, Lily? There you go. Here you get. Come on, Nevaeh. In you go. Nevaeh. Come on. Good job. Where's Bandit going? Come on, mate. I know, buddy. Yeah, too. Oh, good boy. I'll get it ready for you, okay? Here it is. There you go, mate. Good. You two are going to get yourself in trouble. Keep jumping those fences. These two not happy with being left behind. They've jumped the fence just to see what's going on. I'll have to call Sam and let him know that they're no longer in the house yard. Wolfie, Wolfie, this is Dada. Leaving out the driveway now in the bus. See you at lunchtime.
Bye, Dad. We love you so much. He's got a big smile on his face.
Love you all too. See you soon. Wolfie's got the other radio in the playroom. I don't know if you can hear Nevaeh in the background there. It's pretty funny. Looks like there's been an accident here, which is not good. It's all slowing right down. Looks like it's coming to a standstill. I'll turn it around and have a look. Hopefully this isn't too much of a hold up, but this is the main issue with this highway. This is why I used to leave so early to do the daycare pickup. Because it's pretty... So it sounds like it's a bit of a bad accident. Judging by the radio chatter, it sounds like there's significant damage
around the corner as it goes.
to one of the trucks.
Just as you hit the corner, mate, it's on your left hand side, about 20 metres up on the blind spot. Alright, mate, cool, thanks, bud.
It sounds like there is significant damage to one of the truck cabs and they may be trying to free the driver. So it doesn't sound good.
Down to all three.
Made it. We're a little bit behind time because of that traffic, but it's pretty good. Hey Lily, come on. Hey Nevaeh, come on. Hey Bandit, come on buddy. Now we're just going just across the road there to our favourite pie shop. That's the one. I'm going to try and take all the doggies with me. They're all very excited. Good dogs. This way. Stay here, buddy. Stay here, mate. Nice. Yeah, come on. Go get up, Jill. This way. Good dogs. Chili, sit. Good girl, darling. Okay, come on. This way. Good girl. Right here. Okay, come on. Come on. Come on. Well, we got a few strange looks there. Walking through the main street of Camden with these 4 dogs. It was a little bit disjointed. Bandit kept getting his leg caught up in the lead. Nevaeh kept wrapping everyone else up in the lead. I'm glad that we jagged a park just across the road. It wasn't far. We just had to cross the road over. We didn't have to walk too far, which is perfect for our timings because we were late today on the delay on the highway. However, we are going to be on time for the appointment. It just meant that we couldn't dilly-dally in the main street there. There was, someone gave me a heads up about a sweet store or like a pastry place that does a whole heap of different sweets, and said that I would love to check it out, and I really wanted to do that. I didn't have time, so maybe on the way back, if I can find a park, I'll have to explore that shop. The chances of getting a park and a bus on the way back when more people are out, not likely, but we were very lucky this morning. 4 parks in a row that we could just slide into, so, but off we go. We got a chicken and leek pie for Sam to take home, so she'll be happy about that. And let's go do this appointment. Bandit boy on my shoulder there. Just trying to get a lick of the pie. Good dogs. Okay, through. Hold on. Ugh. Okay, come on. darling. And do your characteristic single bark, are we? Hey? This way. Come on. Good dogs. Come on, Bandit. Rightio. Oh yeah, let's untangle these now, huh? Rightio, so do we want to start with one of the two that have been here already?
That'd be good. Let the others settle down a little bit.
Rightio, we'll go with Lily. You ready, darling? There we go. Good girl. Not as much of a bark at you this morning, which is good.
How she doing this way?
Yeah, quite good. I've seen her wanting to jump around a little more, which must mean that she's feeling pretty good.
How's she going with the swimming?
Yeah, very well. She swims very well, but like I said, getting the full extension in her back legs is a little difficult for her, just because she's looks like she's just being lazy. But if I sort of get her to right towards the edge just before she can touch the ramp underneath the surface, she kind of kicks out a bit harder, so I can sort of get her to stretch out a little.
Yeah.
Oh yeah. Come on. Yeah, come here, mate. Good girl.
He's got a pretty decent limp on that front left leg.
Yeah, so Bandit, he's been a long-time client of ours. I think he's, I'm going to get crucified online if I get this wrong. But I'm pretty sure he's 8.
Yeah.
He's turning 9 or just turned, I know I'm going to pay for this. But we've had him come to us since he's been 6 months old,
Right.
and he has suffered from early arthritis from a very young age. He gets monthly injections for allergies, and he's been on restrictions as far as motorbike running and lure coursing for a little while now. But this limp seems to have really gotten a lot worse since the last holiday that he stayed with us. He usually comes up to the farm, he runs around, and then he goes home. He's a bit sore for a couple of days, but comes good. But I've noticed in this particular time that he's come up, he doesn't seem to want to bring that leg forward.
Sure.
But yeah, he's got a few issues with his front legs as far as arthritis, and then this one seems to be giving him a bit of grief. Hey mate. Yeah, so he just happened to be up here on holiday, and I contacted his mum and said, hey, you were happy for me to take him down to see now? And they're very, very good owners and jumped at the opportunity, so hopefully we can help him out. Hello, mate.
area now. Things seem to be settling down quite nicely.
Yeah, good.
Not really seeing any signs of discomfort or pain and palpating through a spine now.
Yep. Oh, that's good.
Tolerate good pressure through there now. Good extension in both hind legs. Extend both hind legs back fairly comfortably.
Yeah, good.
Quite good with that. Quite happy with that.
Oh, that explains why she's a little bit more keen to jump around and be active.
So we'll give her one more treatment today.
Yep.
And that should really just about do it for the moment.
Okay.
And then it's just more about just management and what
Yeah,
you do
sure.
at home.
Yep.
Keeping
Okay.
up with the swimming, keeping up with the exercises.
The massage.
that you're doing.
Yep. Sure. You're right. She's a big fan of the massage.
Oh, good.
He's very enthusiastic about everything. I know. This might not be a good place for you to hang out here, Bandit, on this bit. Come here, mate. Come on. Oh, mate. Good boy. Just relax there. Good boy. Good boy. Hello. Hello. Hey. Hello. Yeah. Good ducks. Tilly's got the idea.
Yep.
Good job, Till. Stay there. Stay there. It's okay.
The dog roll.
Yeah. He used to be the king of all the activities at the farm.
Oh, yeah.
Back in his heyday, yeah. He held the record for the fastest quad run for a while there.
Oh, yeah.
A lot of the activities that we did for the daycare were all based around Bandit, who's one of the originals, and some of the things he liked to do. Yeah, mate. Good boy.
throughout the week, I've been receiving more and more emails from people across the world.
Oh, you have?
And it's just been amazing. Like the amount of kindness and generosity
Yeah.
that are out there with your viewers. It's just
It's pretty special, isn't it?
phenomenal. Like
Yeah.
It's really opened my mind. I always thought kind of YouTube viewing and so forth, it's just all about consumerism.
Yeah.
And
Sure.
what's in it for me sort of thing.
Yeah.
But just the response from your viewers is just
Yeah.
phenomenal.
Oh, good. Yeah, it's a really unique online community that we've got. It is a very positive and supportive community, which is amazing.
Yeah, and that's probably a good word for it, a community where they all are willing to just kind of pitch in and
Yeah.
help where they can, not just with lovely words and prayers, but also like financially. So I've had a number of people contact me now and saying, how can we help financially
Oh, good.
for Luke? So at some point we probably want to have a chat about that and what you want to do with that.
Yeah, right, okay.
But there's been a couple of offers.
Really?
From people around the world. Special
Yeah,
shout
right.
out to Chris Balin
Yeah.
over in America and Tracy Wong. Actually, Tracy Wong's a previous client of mine.
Oh, really?
But yeah,
That's amazing.
Chat about.
Oh, cool. Yeah, it blows me away, the supporters that we've got and the followers that we've got online. Like they send us care packages from all around the world, toys for the dogs, books for the kids, treats and sweets for me and Sam. Yeah, it's pretty special. Hello, mate. Hello, mate. Yes, babe. Good boy. Oh, no, you're excited. He thought he was going home when he got on the bus early this morning. I think he's excited to know that he's not home. The farm trip continues, mate. He's got a reputation for at home time, he disappears.
Oh really?
Yeah, he hides. Yeah, he
The first couple of days, or
Well, when it was a day trip, on a day excursion up to the farm, every time it was time to load the dogs on the bus, I'd always do the count. I'd be one short, and he'd be nowhere to be found. It's about a 10-acre paddock full of play equipment and toys, and you'd search everywhere. I'm like, where is he? And he'd just be hiding in a tunnel somewhere, or behind the hay bale castle or something like that.
I don't want to go home.
Yeah. But yeah, I have to put a disclaimer on. He's got very good owners. It's not like there's anything wrong at home.
Yeah. It just sounds like a pretty fantastic place for a dog to
Yeah.
play for a day.
Yeah. Hello, mate. Yeah, buddy. It's all new, isn't it? Right. That's better than Nevaeh. So Lily's decided to lie down here. Is this bit of an issue for that inside leg there?
They will have a tendency, the coloured needles that I use,
Yeah.
I use them especially for the feet, because they do have a tendency of just bending and moving. They're really
Really fine. Yeah,
like
okay.
0.12 of a millimetre in width.
Yeah.
So they're designed to bend and move,
Okay.
with no resistance at all.
Without causing any sort of
Correct.
internal damage, yeah.
And if there is excessive movement, they'll actually slide out.
Yeah,
Instead
okay.
of actually
Yeah.
bend or bend.
Yeah, sure.
So I'm expecting those ones on the inside of the foot to come out shortly.
Nice and relaxed, Lily. Stay.
Good girl. Good girl. Tiny
Oh, yeah.
hands, so
They are
even
very,
the lightest
very
sort
small.
of touching, they'll just bend a needle
Yep.
and shift.
Yeah, sure.
They're expensive needles, but they're worth using.
Yep. Hello. Good girl.
Sweetheart.
Good girl.
Blue bone.
Ah, sorry. Good stretch there, Lily. That's it, darling.
Oh, that's a good hop you got there too, Chuck.
Yeah, so this is one that seems to be a little bit intermittent. This is the one that I was saying will sprint up the hill and run around, but then when she wants to just relax and chill out, it'll come out every now and again.
Okay.
So often when she first wakes up, gets off the couch, she'll hop to the door and then she'll get out of the door and sprint 200 metres down the front, you know what I mean?
Yeah.
So it's an odd one for me to try and figure out. But she has been lifting it now on and off for probably about 3 weeks.
Okay. So it's been progressively getting worse, about the same?
It's been pretty consistent. Each day I think, oh, it's getting better because she's just full weight bearing and running. But then I've had to force rest her a couple of times just to try to get it to come good.
Sure.
But even on the way here, just from the bus to here, she walked on it for 15 metres, then lifted it for 5, and then walked on it for another.
Okay.
So, should we get her up and
Yeah, we might as well
have a
just
look?
check her out.
Okay. Which way do you want it?
As Lily was.
That way. So we'll just hold her head on this one. If she's likely, if something you find a sore spot, to turn around.
Sure. We'll be gentle. Take your time.
She's a really sweet dog, but we believe that she was potentially wild and trapped by rangers.
Yeah, right.
She was very antisocial when she first came to us. She's been doing a rehab program at our place for about the last 9 months now, and been living free range in amongst my pack for probably the last 2.5 months. And she's just found a new forever home up in Queensland, and they're coming to get her next month.
Okay.
So it's very exciting for her. Hey, darling.
Good girl. I know, darling. Struggling to balance on that.
Yeah. Oh, right.
that
Okay.
leg,
Yeah.
Because as I take the weight off this leg, that
Yeah.
causes her to put weight on the right front
Yeah.
and the left
Sure.
back, and
Okay.
this is the problematic leg. She struggles to balance.
Mhm.
Sorry, darling.
Good girl.
Has she been assessed by anyone at all for this issue?
She got a general checkup a little while ago. We got a vet out to the farm and did all our dogs, and she wasn't limping at that point.
Yeah, okay.
So it wasn't identified.
Good girl. So do a couple of tests on this stifle. See if I can pinpoint what's happening here. Good girl. Oh no, sweetie. Okay, still get good flexion. Good girl. Loading the cruciate ligament by simulating her putting weight on the leg. It seems to be fine. Looking for any evidence of her pulling away from loading that cruciate ligament.
Yep.
Or movement. So we're looking for any shearing between the tibia and the femur. So one of the main jobs of the cruciate ligament system in the knee or stifle, same as us, is it attaches the tibia, the fibula to the femur. And as we put weight on the leg, particularly with dogs because of the angulation of that leg, the force of them putting weight on it kind of wants to push the top of the head of the femur forward.
Right.
And the job of the cruciate ligament is to keep them attached and stop that movement.
Sure.
If there's any damage to the cruciate ligament, when we simulate putting weight on the leg, then typically we'll see either discomfort or pain, indicating inflammation of the cruciate ligament if there's damage, or shearing, movement. And if there's movement, then we know that then there's tearing of the cruciate ligament, and that's a real problem.
Yep.
It doesn't seem to be the case with her today.
Yeah, it's good. Good news.
There's definitely something going on in this stifle. The main area she's reacting is when I palpate around the front of the patella.
Okay.
So you can see when I palpate down this lateral aspect of the knee, which is where the kneecap sits, or patella, she reacts immediately. And that's typical if she's had like a knock or a hit.
Okay.
I've bumped it.
Yep.
And then it causes the bone around the area to bruise. I'm just going to take it through a test and see if the patella is still sound and not wanting to dislocate. Good girl. Good girl. It's still okay. It's still positioning correctly. It's not wanting to slide out or anything. So that tells us that the lateral patellar ligament and the medial patellar ligament is still attached and still working. If they tear, then the patella will then start to dislocate.
Right, okay.
bruising through the back of the tibia. So what I'm doing here is testing the tibial bone itself. So
Yeah.
applying pressure to the back of the tibia on the inside of the leg. If there's any bruising down that bone, they react immediately. They lift the weight off the leg.
Yeah, like she's doing there.
She's doing there. So the main test though is, well, she's weight bearing on it.
Yeah.
Yeah, she's reacting to that as well.
Yeah.
Okay. So there does seem to be some bruising to the bone as well. And this started happening, like, you noticed it after, like, just started showing up? Or she was fine, the next day she wasn't?
Pretty much, yeah. All of a sudden she just started lifting her leg. And it's not uncommon for them to get a soft tissue injury in their feet running through the bush, or grazer pads or something like that. And usually I'll do an inspection and find a small cut or you know, some skin off or something like that. But then when I didn't find anything, I just sort of thought, oh, we'll see how it goes in a couple of days. And like I said, because it was intermittent, you know, I'd get a sigh of relief every time I saw her full-blown sprinting and thinking, oh, she's good to go. But then when she's resting and not being very intense, she decides to lift it.
Good girl. I know, darling. I know, sweetie.
Yeah, good girl, darling. It's all right. It's all right.
Good girl.
Yeah, it's all right.
Quite reactive on hip movement as well.
Yeah.
It's almost like she's had like a decent hit to this leg at some point where it's injured the upper part of the leg. So both the hip joint, the tibia, the front of the patella, but all consistent with like a knock, or like she got a leg caught somewhere and she's trying to pull it out.
She definitely is that type of dog that would take a hit at full sprint and then just bounce up and keep going. She's very physical like that. So it wouldn't surprise me if she did take a hit while we were running through the bush, or you know, with a few dogs shoulder to shoulder, sometimes they can push each other off into you know, either each other or
I'll just compare it to the other side. Check the hip movement on this opposite leg. So I can flex that forward just fine. Extension's still pretty good. She's had an injury to this right knee though in the past. It's an older one. There's significant scarring around her right knee.
Right.
Flexion's reduced, so I can get the back of that hock to about there. Can't get it any further. Indicating the scar tissue is preventing that extra flexibility that should be there. Good girl. Good girl. Lateral mobility seems to be okay. Scarring evident on the inside of that joint on the medial collateral ligament. Stable though. Stable, just something to note.
Sure.
So go back to that hip. Again, I'll be as gentle as I can. Let me get it to about there. The further she reacts. So hip definitely involved as well.
Okay.
But she's done a pretty good number on it. When's you going off to new home?
About a month.
Okay.
4 weeks or so.
Right. Should have time.
Yeah, she's a bit of rough and tumble type dog. She's the type of dog that'll like to, or no stranger to a hip and shoulder at full speed.
Yeah, sure.
Into other dogs. just because she doesn't like coming second.
Mm-hmm.
She likes to be the winner. Bandit, come on, buddy. Good boy, mate. Good boy. Bandit, come on. Good boy. Good boy, mate.
You may have noticed the first thing I checked was the pads on that foot, because
Yep.
you're dead right. The way that she was hopping on that leg does look similar to what you would expect to see if they've had like an injury or a cut to the pad
Yep.
and so forth.
Yeah.
So, well, yeah, always the first thing to check. You'd be amazed at how many dogs I have coming in here and they're worrying about a limp or a cruciate ligament or anything, and then look in the pad and there's a cut. Or
Yeah, sure. Yeah, it's a pretty common one for us doing that. We run through the bush and
yeah,
you know, every year we do a big clean up and try to get rid of all the debris and whatnot, but
yeah,
it's a constant battle with gum trees and all the rest of it. But yeah, the hardest one I found was an actual puncture wound from a stick penetrating between the webbing of the toes.
right.
And I couldn't figure out why this dog wasn't weight bearing, and finally found it and had to be surgically removed. There's about 2 inches of stick in there. That was on one of my shepherd's banjo. Yeah, for me it's usually a sigh of relief when a dog's limping and you lift up and you can see a visible
Absolutely.
wound on their pad. You're like, oh good, it's only on your feet. So for something like that with bruising, is the main thing for her going to be rest?
That's a big part of it.
Yeah.
Rest. Normally, we would be talking about anti-inflammatories to be using to help with the process of getting it to settle down. There's two options there. One would be pharmaceutical anti-inflammatories, which you would get from your vet, which can be helpful to reduce the inflammation, but they also are a bit of a pain blocker.
Right.
So in her case, that may not be ideal because
She'll run through
she's
it.
mental.
Yeah.
She'll just run
Yeah.
and think everything's fine,
Yeah.
and then it's not.
Yeah, sure.
So with her case, it may be more beneficial to be using more of a natural anti-inflammatory, which will certainly help with reducing the inflammation, but doesn't have as much of a pain relieving
Yeah.
effect initially. But as that inflammation subsides due to the treatment of the natural supplements, then her pain will also reduce. But
Yeah.
that's more of an indicator of it actually healing rather than just blocking the pain.
Yeah, sure.
But yes, rest is going to be a big part of it. I'll be avoiding running a lot, particularly chasing quad bikes,
Yeah.
bushwalks, etc.
Yeah.
She can still swim. Swimming is okay because she's able to mobilise the leg
Yeah.
without putting pressure on the joints, and
Yeah.
will also keep that hip movement happening, but under less pressure.
Yeah.
So when we are looking at trying to rehabilitate a joint, it is important to try and keep movement in the joint, but trying to do that without putting pressure on the joint.
Yeah, okay.
Such as in a running scenario.
Yeah, even in the pool, Nevaeh's one to run up the ramp, sprint down the dock and do a massive big jump into the pool, you
Right,
know, so
yeah.
she's going to be difficult to keep quiet even in the pool. But she's very impressive. She's a very athletic, very talented dog.
She certainly looks the part.
So, yeah, we'll just have to try to manage just how intense she is. I've only done a little bit of research into non-steroidal anti-inflammatories and the relationship with CBD oil, where there can be some side effects associated with mixing the two of them, but not nothing past that kind of research.
A couple of side effects on that note. A couple of side effects that can occur. One, extra pressure on the liver.
Okay.
The reason being is it's trying to process two types of treatments, and so liver enzymes can elevate. Even when using CBD oil by itself, with the geriatric sort of conditions, they can sometimes have slightly elevated liver enzymes anyway, because of the CBD oil. But it usually raises a little bit, but then kind of plateaus, stabilizes. What's interesting, I find, is if the CBD oil is given too close to other medications, it can have a tendency of blocking those other medications from being absorbed. Particularly observable in, say, for instance, dogs that are suffering from epilepsy. So if they're using CBD oil in conjunction with anti-epileptics like phenylbarbitones or things of that nature, where the medications, phenylbarbitones, for instance, they need to be given very specifically in hour intervals, whether it be 8-hour intervals or 12-hour intervals. It's got to be spot on. But if it's given at the same time as the CBD oil, or CBD oil is given too closely, and it seems to block the body's absorption of it, and then they start seizing again. So you've got to be a little bit careful when you're using it in conjunction with other medications. Outside of that, though, it's pretty benign, but you just got to be careful with the other medications. In regards to anti-inflammatory sort of supplements, yes, CBD oil can be helpful, but CBD oil is more useful for chronic inflammation. So more of a slow burn. So it usually takes about 4 to 6 weeks before you'll notice changes with CBD oil, whereas in her case that would be too long. So we'd be looking at something that's a little bit more acute, more for acute injuries. A couple that spring to mind, Arnica is probably one of the best ones that springs to mind. It's very easy, it's very cheap to get. Homeopathic version for dogs, like you can't use Arnica in creams for dogs. So with us, if we have like an injury, you can use it as a cream and it actually absorbs through the skin. But dogs don't have pores in their skin, so it doesn't absorb. So they only have pores in their pads and in their tongue, which is why they pant when they're hot. And when they're stressed, you'll notice they'll leave little sweat footprints. So if they're hot or if they're stressed, they'll leave little sweaty footprints. But they don't have pores anywhere else, so they don't absorb anything through the skin unless they're using a chemical with it to help as a transporter through the skin layer. So when using sort of natural supplements, I tend to prefer to use more oral sort of supplementation. So Arnica can come in liquid or tablet form, but it has to be absorbed through the mouth. Being a homeopathic, it needs to be absorbed what's called sublingually, so that's through the bloodstream around the tongue and in the gums. Can be very effective, particularly for acute inflammation to bone tissue and the skin that covers the bones. So there's the skin that covers all bones in the body called a periosteal membrane. And it's a skin that covers the bone as a protective layer. It's also part of the blood vessel system. So that's kind of the area where the bruising will reside, between that skin and the bone tissue. So that's usually the area where we want to be focusing the treatment. So the Arnica can be very helpful for that. There's another product, a homeopathic product called Tramiel, which is exceptionally good as an anti-inflammatory for acute injuries, which is more of a liquid-based sort of product. But the Arnica is very easy to find. You can get it from most health food stores. Some chemists stock it now. Whereas the Tramiel can be a bit trickier to find. Good girl. Good girl.
I think she's more so thinking that it might be a toy.
Just take it slowly. girl.
It's all right, Al.
Good girl. Right. What's a rest?
Yeah, rest for Nevaeh. It's a word she hates.
Good girl. Good girl, darling.
So we're gonna get Tilly up there or Bandit?
Well, Bandit's there. He's been pretty keen to get.
He has,
so
hasn't he?
far.
Come here, Bandit. Let's go, mate. Just a little bit heavier than the other guys. He's very willing to give out licks.
Mm-hmm.
Yeah, good job, mate. So darling.
Good boy. Yeah, no. What's it looking? Right in the eye. Good one.
He's no stranger to cleaning my face 2 or 3 times a day with that tongue. He's very loving. Aren't you, mate? Yeah, good boy.
Boy.
Hey, mate. Yeah, good boy, buddy. Good job, mate.
Thanks, mate. Has any echoes been done with this leg at some point?
I think there may have been a long while ago when they first identified arthritis and whatnot, but
Yeah.
I don't think any time recently.
Sure.
Oh yeah, good boy.
Thanks, mate.
It's impossible for me to kneel down or bend over without getting Bandit's tongue in my face. He approves.
Oh, right in the eye. Oh. Curious to see those X-rays of his spine. Looks to have had some injuries through this part of his back at some point.
Okay.
Just through lack of self-preservation. I mean, boxers are terrible for it.
Yeah.
And around like crazy things. But quite a bit of scar tissue around the site. What I'm looking for when examining through the spine is examining the intervertebral disc spaces.
Right.
So for a healthy intervertebral disc space, there should be a depression. So we have a rise where the spinous process is, or the bony bit, and then we get a dip. And that's where the space is located. And so they're more palpable. You can see them more obviously through the lumbars because the space between the lumbars is a bit wider. But we should still be feeling some sort of depression between each vertebrae, even through the thoracics. And if anything, through this section of these thoracic vertebrae, they're raised. It doesn't seem to be recent. There does seem to be some swelling there, but certainly some scar tissue. So I wouldn't be surprised if there were some arthritic changes on X-ray through here. Mm-hmm. That wouldn't be causing his lameness behind the shoulder blades, but it's just something that I've noted.
Okay.
Now going back to that front left foot, there seems to be quite a lot of discomfort in the back of the elbow joint, particularly in the area of what's called the, where the ulna comes in and attaches at the back of the elbow joint. We palpate just in here, he reacts immediately. So I'm just squeezing lightly with my thumb in the back of the joint of the elbow, and he lifts the leg instantaneously. Right. Now he's a fidget, so he does just kind of footstep backwards and forwards, but there's a difference between fidgeting and when I do this, see how he holds it straight up? Yeah. And this kind of holds it limp? Yeah. Yeah, for sure. If it's sitting, less pressure on that leg. You do the same, he lifts it immediately. Yeah, okay. This breath is awesome. Yeah. So doing the same test on the right foot.
Yeah, he's completely weight bearing.
Change.
Yeah. Okay.
So if we were to look at an elbow model, if we were to superimpose that over his leg, where we see the ulna coming in at the back of the elbow joint here, where I'm compressing when I test that elbow is here, where the ulna comes in and attaches in the back of the humerus here. Okay. And this is a hinge joint, so we do have 3 bones which attach together, but the 2 main bones are the ulna and the humerus, because that's where that hinge is positioned. Okay. And this is also where they get discomfort under compression. So when they compress the leg, it's going to be that area here where it compresses down. If there's any inflammation around this side here, it's going to affect it. There can also be abnormalities at the tip here of the ulna. So we've got the coronoid process on the inside, and then we've got this thing here is called the inguinal process, and they can have issues here as well. Typically, though, we would see that quite young in age if the inguinal process is involved. If it's not something that's in the younger age, it's more when they are older, it's usually like an injury to a ligament or the cartilage surface that runs between these 2 bones. Because where you have 2 bones connecting like that, there will always be cartilage. Okay. And it could be just a cartilage injury. The fact that it's been there for a long time though, it's probably some involvement of the cartilage, possibly some arthritic changes that have developed as well. So we'll give him some treatment for that today. There does also seem to be some tension and irritation through the neck area. Because of him compensating, they have to use their neck muscles more to bring the leg forward. But does still seem to be isolated in that elbow joint. Curiously, there is some inflammation around the elbow, but not a terribly large amount. But it's something to we'll keep an eye on. If it doesn't settle down, we might have to, if he hasn't had an X-ray for a while, we might have to consider getting an X-ray done on that elbow just to double check to see if there's anything going on. Yeah, sure. Okay, do some treatment. There's a bit of a fidget, so I don't know how it's going to go with acupuncture. We might just stick with the laser with him today. Yeah, he doesn't want to sit still very much, does he?
boy, mate. So what does the red light laser do? What's its
Very good question.
function?
So it sends a very specific type of infrared light
Yep.
into the soft tissue, or in this case, the joint. What it does is the specific wavelength and frequency of light stimulates the cells in the area to release an endorphin, which has a nice pain relieving effect and will reduce inflammation over a 3 to 4 day period.
Yeah.
The other thing it does is it stimulates the cells to produce more energy. So inside the cells of the body, we have these little power packs called mitochondria, and their job is to produce energy within the cells, called ATP. And what the infrared laser does is it stimulates the mitochondria to function at a high rate. What's curious though is that if we're using the infrared laser on like healthy tissue that's already functional and working at optimum, it has no effect at all.
Right.
So it's only on cells that aren't working correctly or are injured that they seem to have the effect of stimulating mitochondria. So the good thing about the infrared laser, specific infrared lasers, because there's many types.
Okay.
But infrared lasers are a very good, very safe way of treating injuries, particularly for people at home.
Yeah.
So there are some lasers which can be quite helpful for people to use at home where they wanted to treat at home more on a regular basis, because they're quite safe.
Yeah. If you're in the wrong area, it's not going to have an effect, but if you get the right area, it will help.
Yeah. I mean, there are other lasers. There's more high-powered lasers which you've got to be very careful.
Sure.
Where they can't be used for a long period of time in an area. If it's used for too long, it can actually burn the tissue.
Right.
But those high-powered lasers are usually restricted, and also, I mean, the data on them, in my opinion, isn't that concrete either.
Okay.
The whole idea of more is best isn't always the case.
Right.
More is better is not always the case, particularly with lasers. There seems to be specific strengths that are helpful, and if we go too strong, then they're not helpful.
Right.
They actually overstimulate the cells, and then they kind of shut down for a period of time.
Cause damage.
So the red light that you can see on this laser isn't actually the light that's doing the job.
Okay.
It's just the light that tells me that it's active.
Right.
The infrared light isn't visible to the naked eye. Has a slightly bluish, purplish tinge. This particular laser does. It's called a gallium arsenide laser. Works at about 904 nanometers and has a pulse rate of between 0 and 10,000 hertz. So it's a pulse laser, not a continuous laser.
Okay.
When we use a pulse laser, we get much further penetration. It'll go deeper in the body. Whereas your continuous lasers will only penetrate a certain level.
Okay.
And they're usually the cheaper lasers, and they're fine, but they'll only penetrate a certain depth.
Yep.
About 5 to 8 millimeters.
Okay. And is a infrared laser something that most people would have access to purchase themselves to use at home?
Oh, yeah, there's many online you can get.
Right.
But it's an industry which isn't regulated.
Right,
So it's very confusing. If
Yeah.
you don't know what you're going to buy, you could be wasting your money.
Yeah.
There's many products out there which are, a couple $100 for the lasers.
Yeah.
The idea is you can treat yourself at home, but honestly, those lasers are pretty useless.
Yeah, sure.
You probably get as much benefit from using your remote control on your TV. Good boy. Really good boy. Decent lasers, you're looking for thousands.
Yeah,
But
okay.
they're quite beneficial. As technology improves and the market expands, they are coming down more and more in price. Back in the late 80s, you'd be spending 30, 40 grand for a standard laser.
Yep.
For that same laser now, maybe 4, 5. So
Yeah, right.
definitely come a long way.
Yeah, that's good.
relentless.
I know he is. You can just visualise a 6-month-old puppy in this guy.
Yeah, for sure. It'd be impossible. Thank you. Hilarious, but impossible. Yes. So with this guy, the things I'd be suggesting supplement-wise will be as an inflammatory reducer, but more for things for chronic inflammation. So CBD oil would be a good option.
Yep.
If he's not already on it, that might be something to consider.
Yeah, he is.
Great. How long have you been on it for?
Only since the start of his holiday, which was a week ago.
Okay, right. So we're only early days.
Yeah.
It takes about 4 weeks before you start noticing changes that are slight.
Yeah, okay.
A full 8 weeks before you're going to notice the full potential
Yeah,
of what
sure.
it is you're using. We might also have a chat about the dosages that you're using and concentrations.
Yep.
And see whether it's going to be enough for him.
Mm-hmm.
Because of the nature of his issue on that elbow, over the next 24 hours, he may be a little bit more stiff than that today.
Okay.
Not from the treatment, but because I had to test the joint.
Manipulate that and find where it was
the
sore.
issue is.
Okay.
So that in itself can irritate it for 24 hours. But then after that, it'll settle.
Yeah, sure.
All right, sausage.
Ready to go, mate? Good job. So I know Bandit's mum was interested in the CBD oil, so you sell it here, do you? We might do that for him. And then for Nevaeh, do you sell that product, or I need to go to?
Yeah, I do have some money.
You do. Okay, excellent. How's that, mate? Hey, you get enough licks in? All right, mate. Just relax. Just relax, buddy.
She's going to be the same too, actually.
Yeah, sure.
On that hip.
Yep.
I had to test that pretty thoroughly, and that's going to be quite sore for 24 hours.
Okay.
I had to move it. The tibia and the stifle, that shouldn't be too much of an issue from the palpation, but the hip, because there does seem to be quite a bit of swelling through here, that would probably be a bit uncomfortable. So
Sure.
tonight, just give her a bit of a massage through that area if she's hanging around.
Yep. She always is. She always is. Yeah. Are you ready to
There you go.
Come here, darling. Up.
Good.
Come here. Okay. Good. It is. It heats up once the sun gets there, doesn't it?
Sheds. Hopefully we're in the new clinic in 4 weeks.
4 weeks. That's how long? Oh, that must be a relief.
Once we're in there, yes, it'll be a relief.
Yeah. Yeah. Not over yet.
Not there yet. How's the little Till been?
Till's been very good. Still very active in bursts. I think I've noticed a bit more keen to be out and be involved. So she chooses not to come on the bushwalks or the faster activities, just out of getting a bit older and picking and choosing what she likes.
Yep.
But I have noticed she comes up to the gate and, you know, okay, come on, let's go.
Okay.
So it's a positive sign. Loves getting in the water in the pool. She's always at the pool gate. But I've noticed her come to the back fence and want to come through to the bushwalks now. So she's still on the powder supplement that we got and the tablets.
Great.
And she's also on the CBD oil.
Okay. Running around like a spring chicken in there.
Yeah. Some moral support there from Bandit. Good job, mate.
Don't seem to be as reactive on those elbows today, so that's a positive. Get a bit of extra flexibility on that elbow.
Bit more
A
movement.
little bit more movement.
That's good.
I think I'm dealing with well-behaved dogs.
And I accidentally pressed stop record during that too, so
Oh, bugger.
yeah. But no, Tilly's always been a very high performing dog. Most working dogs are once they know what they want, what you want them to do. In particular for Tilly being a red heeler, it was more so being instantly responsive to verbal commands based on her desire to want to run and nip tyres and
Yes.
things she shouldn't be.
Yes.
Do the different coloured needles mean anything?
Absolutely.
Yeah.
Yep. So these ones, we've got that light lime green sort of colour.
Yep.
They're a bit longer than the last ones we were using.
Okay.
So I use these for more midline sort of points where we've got a little bit of hair to get through.
Mm-hmm.
If I use the shorter needles on this sort of dense, thick coat, it can actually be strong enough to pull them out.
Right, okay.
So I need the extra length for it to sit above the coat line.
Mm-hmm.
They don't go all the way in, they only go about 10 to 15 mil in.
Right, okay.
But the rest of it I need for...
It's just to get through the coat.
Correct.
Sure.
And also thickness of the needle. So these are a 0.14 of a millimetre in diameter, whereas the little green ones, they were 0.12 of a millimetre.
Right.
It doesn't sound like much, but there is a little bit of extra thickness there to give me some more strength. Because when they are a bit longer, to needle one-handed, you need to have a little bit of extra strength through the shaft of it to stop it from bending.
Sure. Very, very small difference though, isn't it? 0.02 of a millimetre.
Yep.
Now that his treatment's done, he doesn't want to fidget anymore.
Yeah. Happy to chill out now. with is it Nevaeh?
Big one. Nevaeh.
Nevaeh.
Yep.
We'll be watching that limp very closely over the next couple of weeks. If we're not seeing any improvements with the rest and with the supplements you'll be putting her on,
Right.
If we're still seeing that limp and it's not getting any better, then we might need to do an X-ray,
Yep.
check that hip out, see what's
Sure.
going on, see if it's make sure it's just soft tissue.
Yeah. Okay.
We want to make sure she's going off to a new home with a clean bill of health.
Yeah. Exactly. Yeah. Yeah. Usually, when a limp doesn't subside within 4 to 6 days, I know something's usually wrong. Oh, hold on. You get to it. Oh, and then back over. Okay, good on you, darling. That's it. Keep coming. Keep coming. Keep coming. Keep coming. Keep coming. There you go.
I'll bring it up a while. Just go underneath it. I'm going to go under, Joe. So for that sort of thing, there are supplements which are more beneficial for keeping the health in the central nervous system, such as lion's mane mushroom.
Right.
It's clinically proven now to help nerves regenerate, which is remarkable.
Right.
For any sort of supplement to do that. Even pharmaceuticals struggle to manage to help the nerves regenerate, but lion's mane mushroom is shown time and time again. It'll help to regenerate the sheath that covers the nerve fibers, the myelin sheath,
Okay.
which is one of the main issues that occurs with degenerative myopathy. So as a supplement, that is usually one of the things I would definitely recommend for all boxers and German Shepherds that are getting older to
Right.
go on to.
Okay.
So if there is any supplement you were going to put them on, you probably want to have that in it.
Definitely.
Obviously, they're larger dogs, so we need glucosamine sulfates,
Yeah.
chondroitins, maybe MSM, various types of sorts of omegas that we could look at as well.
You can supply them with all the supplements that you have for Nevaeh, also Bandit. No change for Lily and Tilly for their treatment.
They're all fine.
So yeah, for the supplements to put Nevaeh on and then also Bandit, that would be fantastic.
Okay, so with Nevaeh, did we want to use the arnica or the tramiel?
Totally up to you. I'm happy to take your recommendation.
Suggest the tramiel is a better option.
Mhm.
It is more expensive, but it is a better.
That's totally fine.
product.
For Bandit,
He's already on the CBD oil, though, isn't he?
he is, but once he leaves home, like once he leaves the holiday, he won't have any. So if we could get some for him to take home,
Okay, so it's a small bottle. Yep, I'll grab one of them.
and then I'll let Bandit's mum know that we should probably look into some X-rays on that elbow.
Yeah, we'll see how it goes over the next. Let's give it the 6 weeks.
Yeah.
I mean, he's had this little limp for a while now, so
Yeah.
another 6 weeks, and just see how he goes on the CBD oil,
Okay.
because it can make a significant difference on elbow. On a side note, if he's not already on an omega-3 or an omega oil supplement,
Yeah.
it might be worthwhile getting him started on emu oil.
Okay.
And it works very differently to CBD oil. Emu oil works on reducing the inflammation through the use of particular omegas,
Right.
particularly omega-9. So it's very high in omega-9, oleic
Yeah.
acid, and that seems to be very effective for inflammation in the joints.
Okay.
And I don't know why, but I find it very successful on elbow issues
Yeah, sure.
or other joints. Elbows seem to be the ones that respond the best.